Hello, everyone. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this segment, I'm going to be going over, due to it being Pride Month, June being Pride Month, I'm going to be going over LGBTQ and gastrointestinal health. My background in medicine made me understand the types of differential impact that that disease plays on different groups, marginalized groups. So let's go ahead and get started here. So these actually apply to many different types of um, systems, whether it's cardiovascular system or GI system. So in my recording for the cardiovascular system, I use this as well. But these are social issues. The idea is that LGBTQ plus are not a separate group, but they face a lot of differential discrimination from the surrounding and stigma, and that can cause some chronic stress syndrome, which is where people that have chronic stress and discrimination, they have poor overall health. So here, LGBTQ plus people experience not only higher cardiovascular disease, but also respiratory and and gastrointestinal disease. So they experience higher gastrointestinal disease risk than cisgender heterosexual peers, driven not by biology, but by social stressors, discrimination, barriers to care. So it's important to note that that LGBTQ plus are not genetically different. It's just how society treats them differently is how some of these disease processes take place. So I wanted to go system by system, group by group in the and the gastrointestinal system. So first of all, hormone therapy effects. Hormone therapy on nausea and GI upset and gallbladder issues. So the hormone therapy that might be used can cause gallbladder issues and later having to laparoscopically take the gallbladder out. So stress and IBS, irritable bowel syndrome, as we know it, is something that is tied to emotional health as well, or or depression and everything is tied to mental health as well. So minority stress theory, as I said, people that face stigma and discrimination have higher minority stress, and this has to do with allostatic load. So if you haven't looked up allostatic load, I urge you to look that up, perhaps in ChatGPT or Microsoft Pilot, because they synthesize that information very quickly. Also, eating disorders, higher prevalence in LGBTQ communities. So, bulimia, anorexia nervosa, and some of the different, like diabulimia, some of the different offshoots of the main eating disorders. Sexual health risk, that's higher too. And I'm going to be going over in the next slide about a little bit more. But anal health among MSM and STIs are especially important. And there's a higher risk of cancer in the anal region as well. And also, sexual health may be affected through HIV and PrEP impact. So PrEP is a kind of preventative sort of measure for HIV, and so that can impact sexual health. Liver, well, as I said previously about gallbladder, hepatitis risk is important as well. So different types of hepatitis, and then alcohol-related issues. If alcohol is something of an issue already, then that can exacerbate the LGBTQ plus health quality. And then again, I went over anal cancer, but cancer screenings like anal and colon cancer screening are especially important. So I kind of like this heart inclusive and affirming care. So finally, I'm just going to go over. I know this is a huge list, but stress and IBS. I already went over minority stress and discrimination, which increases allostatic load. Also, irritable bowel syndrome effects might affect motility. Sexual health risks, we already went over anal health concerns, sexually transmitted infections, and HIV PrEP medication. And then elevated hepatitis risk and alcohol-related liver disease are more common in some LGBTQ populations. And then there might be some body image issues. And gender dysphoria can lead to disordered eating. So having a bad feeling about who you are and your identity might end up causing eating disorder and whatnot. So this, in a nutshell, summarizes what goes on in gastrointestinal health among LGBTQ communities, and I hope this all made some sense. Thank you for listening.